I want to talk for a bit about the medications that can be used to treat type 2 diabetes. Just as an overview, I'm going to have separate videos about each of these things in a little more detail, but just sort of as a general sense of what's out there and the way to think about using the medications. That's what this video is touching on. Um, so if you've watched the other videos I have about how to look at diabetes from the standpoint of insulin metabolism, it's always the best thing to go back to. So it all boils down to insulin metabolism, which is a supply and a demand issue. So your cells have a certain need for the insulin, that's the demand, and then your pancreas makes the supply of insulin, that's the supply. So as long as the supply meets the demand, then I can push all that sugar into my cells and my blood sugar is normal. Diabetes of any kind is a mismatch where you don't have enough insulin to be able to meet that demand, so you can't get all that sugar in. It stays in the blood and you have high blood sugar. Type 2 diabetes is an issue of insulin resistance, and that means that the demand for insulin is too high. Oftentimes, it's in part due to weight gain or obesity. So that's the dynamic of type 2 diabetes. So in order to fix the blood sugar, we really just need to make these two things meet each other. So conceptually, we could do things to lower the demand to improve insulin sensitivity, or we could add insulin. Now, generally speaking, we want to avoid adding the insulin or increasing the supply because insulin does more than one thing in our body, and the worst thing it does, it makes it easier to gain weight and harder to lose weight. So if we treat that person with insulin, we add the supply, we might actually improve the blood sugars at the beginning, but a lot of times that's going to lead to additional weight gain, which then drives that demand up, and then you need to make more insulin. And so, it's not a good long-term solution. So generally speaking, we want to improve insulin sensitivity as much as possible. If the person, we have to ask, does it make sense to do things to help this person lose weight? And usually it does, but not always. So most of the time we're trying to figure out how can we reduce this demand? How can we help this person lose weight? So the medications that we think about first, number one is metformin. Metformin is an insulin sensitizer. It's the most commonly prescribed diabetic medicine. It's the first medicine on all the formularies. It's not super expensive. I'll tell you more about it in another specific video, but that's usually the first thing. After that, we have two different classes of medicines that are both really good, work a little differently. The first would be the GLP or GLP/GIP agonist medicines, and those are the ones that are usually injected. There are some that have orals now, but they work on hormones that affect our gut and our brain as it relates to metabolism and fullness, and so those definitely help reduce the demand for the insulin, and they help with the weight loss at the same time. So usually that's after metformin, that's where we're looking typically most of the time. The other class of medicine that is also helpful along these lines are the SGLT2 inhibitors, the most common being Jardiance and Farxiga. And they work by allowing sugar to pass through the urinary tract more easily. So it's basically your body's getting rid of sugar in a way that it normally wouldn't. So you're getting rid of calories in a way that you normally wouldn't. So that, also helps with reducing that demand. So those are probably, those are the three types of medicines that are the, from the start we're thinking about. Another type of medicine that can be helpful is what's called a DPP-4 inhibitor. Those are related to the GLP medicines, but they're not exactly the same. They work in the same hormone system of our gut. They are pills. The most common one is Januvia. There's also Tradjenta, Onglyza. And these medicines are weight neutral, so they won't cause you to gain weight. They really won't cause you to lose weight. They're usually well tolerated, but they have a mild effect. So sometimes that makes sense. Another medication that helps reduce that demand, that improve that sensitivity is pioglitazone or Actos. There are some other things about the medicine that we have to think about, but again, I'll talk about that in a separate video. But that's another one that's kind of in the background. And again, the other medicines that are there that usually are the last ditch efforts are insulin of any kind, or medications that cause you to make more insulin. And the class that does that, that's most commonly used, are called sulfonylureas, glipizide, glimepiride, glyburide. So anyway, those would be ones we want to avoid. So overall strategy for type 2 diabetes: do what we can to reduce the demand for insulin to help with weight loss. Metformin, GLP/GIP agonists, and then the SGLT2 inhibitors. Those are kind of the main three groups that usually make sense to consider.